Welcome to Louisville Lectures, PEM Little Lectures.
Hi everyone, my name is Liz Lehto. I am a physician in the pediatric emergency department, and today we're going to be talking about different kinds of fracture patterns. So just to review pediatric bones, fractures are much more common in children than adults. And this is because pediatric bones are more porous and pliable than adult bones. Their ligaments are stronger than the growth plates, so while adults may get strains or sprains, kids usually get fractures. There's also rapid metabolic activity during growth, which makes bones more prone to breakage. A torus, or a buckle fracture, is a fracture where the cortex of the bone kind of buckles under pressure, as seen in this diagram here. And fun fact, it's called a torus fracture because the torus is the bottom of a Greek column and kind of resembles what the bone looks like. Now, plastic deformation occurs when there is a force greater than the mechanical strength of the bone. It is seen in children that are less than 4 years old. Microscopy of the bone shows there are microfractures on the concave border of the bone, but these aren't visible radiographically. Now, typically these accompany other fractures, and so treatment depends on the other type of fracture. Now, if there is a plastic deformation that does occur in isolation, if angulation is less than 20 degrees, a removable splint can be placed. But if there's more than 20 degrees of angulation, reduction needs to be done. Now, if a little more force is applied to the bone, then that's what causes a green stick fracture. Green stick fractures are incomplete fractures of the long bones. These are most common in children less than 10 years old, and it occurs when the force applied to a bone results in bending of the bone to a point that the structural integrity of that convex surface is overcome. However, the force isn't enough to break the bone completely, and so the concave surface, that inner surface of the bone, remains intact. And it's called a green stick fracture because it looks like what happens when you bend kind of a green stick or a young healthy stick, where it snaps on one side but not the other. And then if you get a little more force, then you get what's known as a complete fracture, which is fracture through both cortices of the bone. Another type of fracture pattern is the Salter-Harris fracture. And this is a classification for fractures that involve the physis, or the growth plate of the bone. So just a quick review of our bony anatomy. We have our growth plate right here with the epiphysis above, the metaphysis below, and then the diaphysis is that shaft of the bone. Now, the cool thing about Salter-Harris fractures is the name is the mnemonic, so they can be pretty easy to remember. So let's review. A Salter-Harris 1 fracture is a fracture that is straight through the growth plate. And in these, the X-ray can be normal, as seen right here. The diagnosis is often clinical, and when there's tenderness to palpation over the growth plate in the setting of a normal X-ray, we'll call that a Salter-Harris 1 fracture. Salter-Harris 2 fracture is above. So it's fracture through the growth plate as well as the metaphysis. This is the most common physical fracture, and it has a very good prognosis. A Salter-Harris 3 fracture is lower, so fracture through the growth plate and the epiphysis. Salter-Harris 4 is through everything, so it's a fracture through the growth plate, the metaphysis, and the epiphysis, as seen here. And Salter-Harris 5 is rammed or erasure of the growth plate. And this is a crush injury of the growth plate that leads to kind of obliteration. This one has a pretty poor prognosis because you've lost your growth plate. And so growth arrest and partial closure of the growth plate are common. Now, this mnemonic, the straight above, lower, through everything, and rammed, is fantastic if your bone is in this orientation, with the epiphysis below and the metaphysis above. But remember, there are two ends to a bone. And when you have one oriented this way, with your epiphysis above, that makes this mnemonic a little harder to use because your above fracture is now a type 3, which is through your epiphysis. So there's another mnemonic that can help us remember that, and that is knowing your mean, M-E-M-E. And so a type 2 fracture is through the metaphysis, a type 3 is through the epiphysis, and a type 4 is through the metaphysis and the epiphysis. So knowing your Salter mnemonic and knowing your mean will help keep these straight every time. Thanks for listening.